I want to shift gears just a little bit. Yesterday, we heard a lot about the challenges we are facing to fill positions in healthcare fields. And I think this has been a challenge throughout the entire pandemic, and probably something that even precedes that pandemic, and actions by the federal government with requiring healthcare entities to let go of employees who opted not to be vaccinated. That's another issue outside of your purview. However, institutions of higher education, they continue to work with our healthcare providers to find ways to meet the needs of the healthcare industry. Colleges and universities are continuing to retool and adapt to provide students with the greatest opportunity for their success in the career field in which they studied. Last May, the Pennsylvania Higher Education Nursing Schools Association sent the governor a letter seeking greater urgency with the State Board of Nursing in their review of existing application for curriculum revision and new program approval. And we hear all day, every day, about the need for workforce development. Education to career, it's something that really seems so very simple. And the governor certainly has been out there talking about it. I've been looking at lots of press releases. I actually did a search, 17 press releases issued by the governor since the start of 2022 that include the word workforce development. Yet, when I look at the letter that those nursing schools sent to the governor back in May, I then read things like this. The University of Pittsburgh, when they waited 2 years for approval from the State Board of Nursing for new programs they were seeking to implement. Duquesne had issues. Their information was sent to the State Board of Nursing in October of 2020. They weren't acknowledged until April and May of 2021. Carlow University didn't have any feedback from the State Board of Nursing for 18 months on curriculum changes that we're seeking with their Master of Nursing and Nurse Practitioner program. And at home, in my home county, York College worked with our county's largest healthcare provider, WellSpan Health, to create a program that was specifically requested to meet the growing needs of healthcare patients in my community. And it took the board 2 years to approve the psychiatric mental health nurse practitioner program. Almost a year ago, they submitted to your department an application for a family nurse practitioner program. They have not heard back any feedback from the board. So, we're talking about this 17 times. We've heard from the governor since in this year, but the bureaucracy is failing to keep up not only with the needs of healthcare providers and students, but the community. There is a dire need. That mental health practitioner is something that is such a rare commodity and such a skill that is so needed in our Commonwealth. So I'm concerned that these ongoing delays to review new programs, they're going to stymie opportunities here in the Commonwealth for healthcare professionals, for students, for universities, for healthcare providers. So can you talk to me about what changes are being made to ensure that not only the nursing board, but every licensing board under your department's purview are meeting the demands of the community, the private sector, the public sector on issues that are so critical, like healthcare needs in our communities, and also how you can expedite these reviews, because we can't get those healthcare professionals into the community without educating them first.
Well, thank you for raising this concern. And, we are entering the third year of the pandemic, and there was a nursing shortage before the pandemic, and it's really been exacerbated by it. So we really have to look at a comprehensive approach. Nurses are retiring, they're leaving patient care, but as a department, we need to make sure that we are processing those licenses as quickly as possible. So as I mentioned before, with the PALS system replacement that we are requesting. That's something that I think will definitely help and streamline, but there are a lot of.
But this is even before we get to the PAL system, right? And we all, every single one of us, no matter where we represent in this Commonwealth, could probably tell you a laundry list of issues with regard to the licensure. But this is how we get the programs in place to educate those individuals to be able to get them licensed into the field. And I know it's hard to track down those people who can teach in those programs, but the institution of higher education in my community that helps to educate people to become those healthcare practitioners in the community can't get their programs approved in a timely fashion. I mean, 2 years to try and get a program through to put more mental health practitioners into the pipeline, and 2 years to do that. Now they haven't even heard anything on their latest application. Almost a year. They applied last March. So how can we expedite those reviews so we can have the programs in place to educate the people, to put them on the front lines? We have a growing mental health challenge here in the Commonwealth, but every hospital, every doctor's office, they need those health practitioners.
Right, and I definitely appreciate that feedback. I'm going to ask Deputy Secretary Iovino to talk a little bit about what we're doing in the meantime, because PALS is one piece of it, as you mentioned, but we are making improvements to expedite in the meantime. So, Deputy Secretary.
Thank you, Secretary Chapman. Senator Phillips-Hill, there is a backlog in these curriculum reviews, and I also want to acknowledge in the setup of your question is that how critical these reviews are. And the nursing field is the perfect example. The field, the profession is evolving. And so what the educational institutions are staying on top of is ensuring that their curriculum is matching the skill sets that they need to send these healthcare professionals out to the field. And so we do have a responsibility to review those curriculums. I want to get back to you on a status with each and every one of those universities. I will also say that the individuals that are the evaluators for those curriculum reviews it's a very specific skill set, and they have at least master's degrees themselves. It's hard to recruit and hire them, and we are not competitive in this field in what we can pay because of how sought after they are for a variety of different positions that they can go to with the level of education and experience they have. And I'm going to turn to, so I will get back to you on the status of all of them, but we've had a vacancy in this area for quite some time. It's very difficult to fill them, and I just wanted to give Commissioner Claggett an opportunity to comment on where it stands with regard to filling the position.
I appreciate that, and it's hard when the Department of Health, the Department of Human Services are pleading for those additional resources, and we realize there's that challenge in the pipeline to get them there. So I appreciate, Deputy Secretary, the follow-up. Thank you.
Thank you, Senator.
Thank you, Deputy Secretary. Yeah, so currently we've hired new staff to do the curriculum reviews within the Board of Nursing. In addition to that, we are currently working overtime to get caught up on the reviews.
Thank you. And I think if you could, I know that in conversations with Chairman Brown, he indicated there may be some challenges at DeSales University as well. Letting them know, just having that communication with them. There's a lot of frustration when they don't hear the status of where it is. And when they come to us, that there's a problem there. So being able to communicate with them and letting them know that it's in the pipeline and that it is going to see review at some point, I think would help alleviate some of the concern as well. But certainly, again, anything that you can do to help assure that we get the programs in place to get those healthcare professionals into the field would be appreciated. Thank you very much. Thank you, Mr. Chairman.
Thank you.